Colleagues at the ACLU National are looking at some of these conditions of participation and seeing if we can think of some ways to strengthen them and get better enforcement. They do, for example, say that the patient has the right to participate in the development and implementation of his or her plan of care. And this includes being informed of his or her health status, being involved in care planning and treatment, and being able to request or refuse treatment. We've got some other cases of miscarriage, mismanagement that would make your hair stand on end, even worse than this one I showed you. And we're looking at filing some complaints, some violations with CMS about women not being properly informed of their status, not being able to choose the option that would be right for them, such as being able to complete the miscarriage at the hospital. Another way to get at this is to strengthen state oversight of these proposed hospital partnerships. Now, your governor was asked earlier this year by the Washington Coalition for Patients' Rights to declare a moratorium on all hospital transactions in the state because of this runaway Catholic takeover of all the systems. He did not agree to that. However, he did do something quite good, which was to call on the Department of Health to improve the hospital review process. Many of these Catholic secular hospital partnerships are kind of flying under the radar of your state regulations here because they are not a sale or acquisition. They are a partnership, they are an affiliation, they are a joint venture, they are some other form of transaction. So, the Department of Health just this week released 2 new proposed rules. And I'll tell you just a little bit about them, but I want to encourage all of you to support Rob in submitting, comments, praising these, and how to make them even better. The first one would do more to ensure a public process for reviewing changes in hospital ownership or control. It would change the existing regulations to broaden the definition of the type of transaction that has to be reviewed. So it would bring more of these under state review and give you all an opportunity to look at them, to request the documents, to file public comments, to raise a ruckus, basically, like those people in Arizona did. Another one of the rules would require hospitals to submit to the Department of Health their reproductive health policies, and I believe also their end-of-life policies. So you would be able to look up a hospital on a website, the Department of Health website, and find out what did they say in the policy they submitted to the DOH about end-of-life, I think LGBT, anti-discrimination is another one, and reproductive health. We're savvy enough to know that they may be able to try to get away with just saying, oh, we'll honor the patient's end-of-life wishes unless they're contrary to Catholic moral teaching. But you're not going to let them get away with that, are you? You're going to speak up. You're going to say, no, it needs to be more specific than that. Another thing you can do is organize, educate, and speak out. I think one of the reasons that Rob asked me to come here today was to put this on your radar screen, if it wasn't there already, to give you some basic information you could use to talk with your neighbors, your families, your communities about this, to tell hospital boards and elected leaders in Washington that you don't want religious health restrictions to put patients at risk, to deny you your choices, to deny people the basic health care they need. I believe there is a petition in formation. It's not here today, is it?
Be ready on Wednesday.
Be ready on Wednesday. So Rob will make sure you have access to it, and it will call on your Washington elected leaders to not let this happen, to protect patients' rights. You want to support, to the extent you're able, the work of the Washington Coalition for Patients' Rights. And I've listed as many of them as I could remember. including compassionate choices, you will see that this list is a great list. You've got a strong, active coalition here that brings together end-of-life rights groups, reproductive justice groups, LGBT groups. That's what you need. You need to get all three of those movements together to make an impact on this. Because any one of you by yourself, you know, can be dismissed. You know, can be overrun. You know, can be targeted by the bishops as not a good organization. But if all three of your movements are together, you can be united and have a real impact. And I want to end by saying that MergerWatch is here to help if you need us. We are in New York, but we act as essentially free consultants to groups like the Washington Coalition for Patients' Rights. We're very much guided by whatever the decisions are of the people on the ground in that state, because you know best what's going to work for you. But we have a lot of experience now with these mergers all over the country. We're actually up to 100 cases now in 35 states. And we have had some track record of success. We've helped community coalitions defeat 35 of these mergers, including the one in Sierra Vista. We've helped overturn 13 existing mergers that were proving bad for patients and for physicians. And in 24 cases, we've managed to help work out some sort of a compromise if there was no other alternative. We don't always like these compromises, they're not always perfect, but if there is no other alternative, that's where we go. So we're there to help if you need us, and I want to very much applaud all of you for coming here today to learn about this, for making a commitment, I hope you have, to working on this as an important issue for Washington, for your families, for your friends and your neighbors. And I want to thank you so much for the opportunity to share some of this with you today. Thanks.